Good evening everyone, and welcome to another instalment of our virtual NAS classes. I'm going to go through some really basic knee and ankle strengthening exercises. These are ones that you'd be able to complete easily within the comfort of your own home, on your bed, on the floor, if obviously able to get up and off the floor safely, seated in a chair and so on. The main aims are to focus on sort of stretching and strengthening the limbs at the same time. So I hope you'll find it of benefit. So let's talk about some of the basics of what we're trying to achieve from this session today. My main aims are to promote range of movement, strength, and also stretching of the muscle tissues above and below the joint. I want you to work within a repetition range of 4 to 8, potentially up to 10 to whatever your comfort is. However, if you are going above 8, it might be the fact that the exercise might not be as difficult for you, so therefore what we need to do is add maybe a stretch or a hold during that exercise, which is what I'll go through when reviewing the knee exercises and the ankle exercises themselves. Furthermore, and just to add, I'd like you to aim to complete 2 to 3 sets of these exercises. It's up to you whether you want to complete them separately or if you complete them in a circuit format, making sure you have sufficient rest between exercise, for example 30 to 60 seconds, before then completing the next set. So just to begin, these exercises can be completed in comfort of your bed, or if you're able to, on the floor. Use a soft surface or mat if you have one. One of the first exercises for the knee that you can do in bed, and this could be, for example, when you're woken up in the morning, you're just trying to warm yourself up. And that's just what we call gentle knee flexion. So you can do one leg up first and slowly down, and then the other one up and slowly down. What I like to try to aim for is keeping the knee and the big toe pointing directly towards the ceiling, just so you're making sure you're getting that good fluid range of movement. And for example, you'd probably do 4 to 8 repetitions on each leg, have a rest, and then commence on to the next set. All right, so I'll run through it now in terms of what I mean in real time, and then we'll proceed through with the next exercise. So 1, 2, 3, 4, 5, 6. Okay, so you're getting that fluid around the knee joint, which hopefully should ease any stiffness before you get up in the morning. You give yourself 30 seconds to a minute, and then you proceed with doing the same exercise again. Again, aiming for 2 to 3 sets to whatever's comfortable. Nice, slow and controlled. Really focusing on what muscles you're using. Hopefully increasing your range of movement as you proceed. And there we go. The next exercise I want to demonstrate is what we call working on the inner rage quadricep muscle. So it's just this group of muscles on the inside of your leg. A towel roll is perfect, a foam roller even better because it's a bit firmer. But what you want to do is you want to place it below the knee joint like so. You want to push your knee gently into that towel roll to start engaging that muscle group. Pull your toes towards you and lift up. So you're effectively straightening the leg. You're holding that for 1 to 5 seconds to whatever's comfortable, and then you're slowly lowering the knee. Not the knee, sorry, the ankle. All right, so gently contract and pull up. Hold, 3, 2, 1, and down. Again, aiming for 4 to 8 repetitions, again what's comfortable, before then you swap over to the other leg to allow this one to rest, so you can continue them consecutively if you feel comfortable to do so. Again, making sure it's in the right position, toe pointing to the ceiling, kneecap pointing to the ceiling, gently pushing into the towel roll, pull toes towards you, and straighten that leg and hold for 3, 2, 1, and relax. Again, like I said, 4 to 8 repetitions. You will feel some gentle pulling at the back of the leg, even possibly on the front, potentially even the back of your leg here behind the ankle. Again, that's normal. All right, just make sure you're having 30 seconds to 60 seconds rest between each set. The next exercise is one that I favour during our exercise classes, and that's a bridge. Again, it can be completed in the bed or on the floor, whatever's comfortable for yourselves and what your abilities are. Lie nice and flat, hands down by your sides. Knees flexed to about this sort of distance, okay? Feet pushing into the ground, and what you're wanting to do is lifting your bottom up, nice and slowly and controlled, and extending your hips, okay? So holding there for up to say 5 seconds. 3, 2, 1, and relax. So I'm going to aim to do about between 4 to 8 repetitions. Up, 1, 2, 3, 4, 5, and down. And up, 1, 2, 3, 4, and down slowly. Last one, and up, 1, 2, 3, 4, 5, and down slowly. Again, at this point you rest. Whether you want to, in between exercises, for example, add maybe some gentle knee rolls, just to help loosen up that lumbar spine as you do this exercise, it's absolutely fine. Again, I really want you to focus on working in a range of movement that's comfortable for you. You're pushing yourself ever so gently, but you're never working into that pain. Another way you can progress this exercise, and if you've got some TheraBands or bands like so, is if you can do, you want to pop them down the base of your leg like so, just above the knee joint. Okay, mine's obviously rocked up slightly, but what this focuses on is you want to stop your knees from dropping inwards. You're trying to sustain the hold there, keeping your knees nice and in line, so the bony parts of your hips here, they're in line with the tops of your knees there, and again with the big toe. And this helps you just focus on isolating these muscles here too, to try and sustain a better hold and strengthen the outside of your hips. All right, so what we'll do is we'll do again about 4 repetitions and add a 5-second hold in between. So up nice and slowly, 1, 2, 3, 4, 5, and down, and up, 1, 2, 3, 4, 5, and down, and up, 1, 2, 3, 4, 5, and down, and again up, 1, 2, 3, 4, 5, and down. So taking this off, the next step of progression, if you feel comfortable with doing that, is completing the bridge as I've demonstrated, but adding a single leg into it. Okay, holding again for about 5 seconds, lowering that leg down, then your bottom down, and then going back up and doing the other side, and holding again for another 5 seconds. But the 3 variations of bridge I've just shown you are for you to progress up to. You do what is comfortable for yourself. All right. Again, like I've said, you want to be aiming between 4 to 8 repetitions, holding for about 5 seconds at the top, having a rest of at least 30 to 60 seconds between sets. But if you want to keep it as an active rest break, then just gently maybe add some knee rolls either side in between. All right, so you're getting some other joints involved with the exercises as well. Right, the next exercise, and if you're able to lie on your front, what we call in prone, is a good one to help strengthen the hamstring muscles and the back of the knee, okay, and then also improving that range of movement is again gentle knee flexion, but in this position, so trying to bring your heel towards your bottom and back down again. Again, you can alternate legs. Again, you can work between 4 to 8 repetitions, whatever you feels comfortable. If you are able to, and it's safe to, of course, you can place one of the TheraBands at the base there of the heel, or sort of the back of where the Achilles tendon is, and make sure that's attached firmly to a really strong supportive surface, and then you can add some resistance to it. All right, so therefore it's really working the hamstrings. However, from a range of movement perspective, and for stretching the quadricep muscles, which are based at the front of the knee, this is actually quite a nice, comfortable exercise to do. If you want to add a stretch and hold to it once you've done a few of the repetitions, please do. Again, you should aim to stretch the hold between 20 to 30 seconds, but obviously, of course, what is comfortable for yourself, all right? So make sure you're swapping legs, but making sure you're supporting your back as well, not twisting too much that's going to cause you any discomfort. All right, again, holding for about 20 to 30 seconds. And that is more or less some really simple and basic exercises for the knee. So what I'm going to demonstrate to you now is some really simple exercises that you can do in the chair. So this is a great example of some things you can do, especially if you're at work or having to sit at a desk for long periods of time. The way I'd like to start things is working from the ankle up. Okay, so this is going to start to incorporate some of the ankle exercises I'm going to go through after this video. The way I'll do that is by doing some gentle heel raises, with toes then lifting up afterwards. So heel up, then lift toes up, okay? These will act as a nice pump, getting that blood flow down to the base of your joints there. Again, complete for about 20 to 30 seconds, have a rest, and then complete another set. Moving on, what I like to incorporate now is around the knee, and that's just simply straightening the knee out, okay? How you want to do it, make sure you're sitting nice and firm in your chair, your back nice and supported. You're going to be gently raising the foot up, straightening up. I'm not lifting from the hip, I'm not hitching. What I'm doing is I'm gently straightening the knee joint and then I'm pulling toes towards you. In that position, you then hold for 5 seconds and then slowly relax down. You can either focus on one leg at a time, or you can then incorporate the other leg. Pulling toes towards you, feeling that nice stretch behind the back of your leg all the way up and resting down. Again, it's important that you're not hitching at the hip or you're trying to lift up like this, because what that'll do is it'll shorten a lot of these soft tissues at the back of your leg. What you're trying to do is really focus on that knee joint itself, all right? So stretching out, pulling toes towards you, holding for 5 seconds, and then down again and completing it then again on the other leg. Aim for about 4 to 8 repetitions on each leg, as I've been saying. Have a rest for 30 to 60 seconds, then go again. Another one you can do very gently under the desk is just some gentle marching, okay? Yes, this is more probably focused on the hip joint, all right, but you're still promoting strength and movement in the lower limbs. Again, up to you, complete for about 30 to 60 seconds if you feel comfortable to do so, because it incorporates a lot more joints. Just making sure you're having that equal rest time as well. Okay, brilliant. So now I'm going to talk very, very briefly about what the ankle joint does. In terms of its movements, it plantarflexes, so toes point down. It dorsiflexes, where toes come up towards you. It inverts, so where the ankle rotates inwards. And it everts, where the ankle rotates outwards. A good warm-up exercise to do even when you've woken up in the morning, or for example, if you're sitting at the desk at work, etc., is paddling those ankles up and down. I'd aim to do so, and do it so quite vigorously for at least 20 to 30 seconds. Okay, really focusing on that ankle moving up and down as far as you can in a comfortable manner. Have a rest for a few seconds and do another couple of sets. All right, so really promoting that blood flow down to the lower limbs. Another little tip and trick is, for example, pretending that your big toe is a pen and either writing out your name. Because what that does is it promotes different ranges of movement throughout that whole joint, along with obviously doing it on the other foot as well. You can do the whole A, B, C, D, E, etc. if you need to, or find other creative ways of doing so. So a little tip, on average you should be spending at least 2 minutes brushing your teeth. You should also be doing that in the morning or the evening, or after meals. What you can do to contribute towards a strengthening exercise of the ankle and also supporting your balance is standing on one leg for 30 seconds of those 2 minutes. Once those 30 seconds are up, for example, you then alternate to the other side, holding again for 30 seconds, and then repeating again for that last minute. So holding again for 30 seconds on one leg, and then repeating on the other side. And as I've said, that's a really good strengthening exercise. It works on proprioception and also improving your balance. So another exercise to practice on strengthening the ankle and also the back of the leg is heel raises. Now there are 2 variations of this exercise because they work on different muscle groups. You can do them with a straight leg. So for example, lowering yourself down slowly and pushing up nice and tall. Notice that the front of my foot, the ball of my foot is on the step nice and safely. I'm holding onto a supportive surface. I'm gently lowering down to what is comfortable, and then I'm driving up nice and slowly and holding at the top. Again, aiming to complete at least 4 to 8 repetitions, okay? So we're focusing on that strengthening aspect. The next way, and to work a different set of muscle groups, is to gently unlock the knee, okay? So they're gently flexed, and completing the exercise exactly the same, okay? So keeping those knees gently flexed, lowering down slowly, and back up again. It's quite a tricky exercise to do when you get used to it, but again, it has more benefits by hitting different muscle groups of that part of the lower limb. Again, aiming to complete 4 to 8 repetitions, holding for a couple of seconds at the top, and then lowering yourself down slowly. So there are other ways we can strengthen the ankle in isolation, and that could be through the use of a TheraBand by working those different planes of movement to whatever's comfortable, okay? However, what I find is most beneficial is ensuring that you have got good, supportive and correct footwear that's appropriate for your foot posture, okay? Insoles if you need them, but make sure it's something that you've discussed with the specialist about to make sure you're getting a best benefit and obviously not spending on something that's not going to be supportive. My advice to you that walking by far is one of the best exercises anyone can do. It's really good for the proprioceptive aspect, for the cardiovascular aspect, along with general strengthening and conditioning. Thank you for listening to this one, and hope to be seeing you all very soon.